Okay, this is chapter 9, it's the hematopoietic system. The outline, and we're going to look at the physiology of blood, the diseases of red blood cells and white blood cells, along with diseases of the platelets, so bleeding disorders. So here's your chapter objectives. Make sure you can answer those, and your key terms that you can define those. So the physiology of blood. So red blood cells, erythrocytes, and platelets, thrombocytes, are made in the red bone marrow. So white blood cells, so leukocytes, are produced in both red marrow and lymphoid tissue, so lymphoid tissue. Erythrocytes contain hemoglobin, and hemoglobin is an iron-based protein that carries oxygen to the body's tissues. So types of leukocytes, there's neutrophils, eosinophils, basophils, lymphocytes, monocytes, and white blood cells function as a part of the immune system. So you can see your red blood cells here and your platelets here. When we look at your white blood cells, we have the glandular leukocytes and non-glandular leukocytes. So your glandular leukocytes include your basophils, neutrophils, and eosinophils, and your non-glandular is your lymphocytes and monocytes. So diseases of the red blood cells, you have anemia and polycythemia. So what is anemia? Most females that are menstruating have anemia. It's very common. So it's a decrease in the amount of oxygen carrying hemoglobin in the peripheral blood. So the most common type is iron deficiency. There's hemolytic, which is a shortened red blood cell lifespan. There's megablastic, which is a deficiency in your vitamin B12. There's aplastic, which is bone marrow failure, which is probably the most severe type, and the myelophilic, which is infiltration of the bone marrow with non-hematopoietic cells. So hemolytic anemia is a shortened red blood cell lifespan, and the major hereditary forms are the spherocytosis, sickle cell anemia, and thalassemia. Thalassemia is probably the coolest one you'll see. So this is a lateral skull, and you can see here it has hair on end. So it looks like this person has just hair standing straight up, and that is that's the problem there. And down here, you'll notice that this is normal, down lower than the. So the calvarium is normal, so just below the occipital bone, heading around. So it's normal. So just up here where the red blood cells are formed is where you have the problem. And sickle cell anemia here, so this is bioconcave, which is both sides, the superior and the inferior margins of the soft vertebral bodies, produces characteristic fish vertebrae appearance. So and you can see in this one here, there's localized step-like central depressions of the multiple vertebral end plates. So there's just these little notches top and bottom. And aseptic necrosis of the femoral head in sickle cell anemia. So you can see here, this bone does not look normal. You can see that there's patches here. So model area of increased and decreased density reflect osteonecrosis without collapse. So the tuberculae in the neck and the interconcharic region are thickened by apposition of the new bone. So a solid layer of bone along with inner aspects of the cortex of the femoral shaft causes narrowing of the medullary cavity. So if you see this on an x-ray, this is very concerning here. Okay, polycythemia is an increase in production of erythrocytes, granulocytes, and platelets. There are primary and secondary forms. So the primary form is characterized by hyperplasia of the bone marrow. The secondary form is a result of long-term inadequate oxygen supplied in patients with severe chronic pulmonary disease or congenital cyanotic heart disease, or it may develop in persons living in high altitudes, which I found very interesting. So you can see here, these lungs look terrible. So severe hypoventilation by profound obesity. So this patient is very large. And enlargement of the pulmonary vessels along with cardiomegaly. So cardiomegaly is not common, but this patient has it. So yeah, this is a problem. So this, you can see these lung fields do not look right or normal. So a decrease in your white blood cells, we're talking about leukemia, lymphoma, and infectious mononucleosis. Leukemia, we hear about leukemia a lot. It is a neoplastic proliferation of white blood cells. So there's two major types. There's myelolytic and lymphatic leukemia. So myelolytic is a cancer of the bone marrow, and lymphatic leukemia is a malignancy of the lymph nodes. The only white blood cells that are dramatically increased are the lymphocytes. So they have to rule out which type they're dealing with patients. Excessive white blood cells circulating causes a decrease in circulation of the red blood cells and the platelets. So here, acute leukemia, so proliferation of the neoplastic cells in the marrow has caused extensive destruction of the bone in both femurs. So you can see how the bone just does not look healthy through here. And you can see here on acute leukemia also, in addition to radiolucent metastases bands, there are frank bone destructions of the cortical erosions involving many metatarsals and proximal phalanx. So yeah, yeesh, poor patients. All right, chronic leukemia. So you'll see splenomegaly, so you can see how big the spleen is, and downward displacement of the splenic flexure of the colon on the upper abdomen. Arrows point to the inferior margin of the spleen, so you can see the flexure here and coming around. It's depressed due to the enlarged spleen. So giving a whole bone scan, and we have it tag the white blood cells, and you can see the grossly enlarged spleen on the patient. Lymphoma is a neoplasm of the lymphoreticular system, which is your lymph nodes, your spleen, your lymphoid tissue, and parenchymal organs such as the GI tract, lung, skin. There's two major types. There's Hodgkin's and non-Hodgkin's. This is where the mediastinal nodes get enlarged, is the most common finding that we have for lymphoma. So this is very common. You can see the large mediastinum here. So this is more on the normal side. It's still a little widened, but here you can see how wide this is. So this patient has lymphoma, and this patient here has been treated for lymphoma after chemotherapy. Usually lymphoma responds really well to chemotherapy, which is nice. This is lymphoma of the stomach. I have seen this before. I didn't know what I was looking at. It totally threw me off. I wasn't sure if it was cancer. So I did as much imaging as I could, and then I thought, well, maybe this is some kind of inflammatory process, which kind of was. So this is lymphoma of the stomach. Infectious mononucleosis. We call this mono, right? So it's a self-limiting viral disease of the lymphoreticular system. It's characterized by vague symptoms. So you'll hear people say, you know, I'm really tired, I have a sore throat, they have a low-grade fever, and they have swollen lymph nodes. So Epstein-Barr virus is thought to be the cause, and infectious mononucleosis primarily affects young adults. So infectious mononucleosis, here's the APN lateral of the chest with enlarged hilar lymph nodes bilaterally. So you can see with the little arrows here, the enlarged lymph nodes. You can see that's all enlarged. Disease of the platelets. So we have hemophilia and purpura, thrombocytopenia. All right, hemophilia is an inherited by a sex-linked recessive gene anomaly of the blood coagulation. It appears clinically on males. It is characterized by decreased or absent serum concentration of anti-hemolytic globulin, so factor 8. A person who has hemophilia is prone to spontaneous hemorrhage or severe bleeding from minor cuts or injuries in their lifetime. So radiographic changes in hemophilia are complications of recurrent bleeding in the joints. So they can just start bleeding internally. So you can see here there's a large cyst, and that is from bleeding, and you can see here this is destructive from bleeding. Skeletal changes. Purpura is also called thrombocytopenia. It is a deficiency in the number of platelets. It's a decrease in production, increase in destruction, and splenic sequestration. Purpura results in spontaneous hemorrhage of the skin, mucous membranes of the mouth, and internal organs. That doesn't sound like a fun one to have. All right, so radiographic changes caused by either acute or chronic idiopathic thrombocytopenia. Purpura primarily involves the GI tract. So hemorrhage into the small bowel produces characteristic uniform or regular thickening of the mucosal folds and affects the intestinal segment. So we can see here how abnormal. So this here looks normal. This part right here is just see how inflamed and feathery. So this is a really, really sick patient here. A lot of pain. Okay, so that's it. Yay, it's an easy one.